Session number 3. If you are a medium-sized practice looking to capture over $1 million from a single pair in quality incentives, then don't miss pair quality meetings. Yes, don't miss pair quality meetings. My name is Maruk and I help practices earn incentive dollars by closing care gaps and improve overall quality scores. This is part 3 of the 4-part series on how to actually close care gaps and earn incentives. Let's dive in.
Welcome to the quality training session. Woohoo! So many practices.
Let's continue our discussion on the third most important step in order to earn maximum quality incentives for your practice, which is attend pair quality meetings. And pair quality meetings are scheduled by your insurance to educate the practices on quality, and they are different from monthly provider trainings organized specifically by your practice for your practice to educate your providers on the internal processes followed within your clinic. Pair quality meetings will have so many practices. Before we start, it's important for me and for you as a practice to know who is really going to your pair quality meetings. And let's be honest, I know it. Yeah, I know it. Who is going to your pair quality meetings?
What do you mean, who's going? I'm Bill, from Billing. I show up every month just in case they sneak in ICD-10 updates.
I don't get half of what they're saying. But hey, as a practice manager, at least I take great notes.
Hello, Maruk. Yes, Dr. Babu speaking. Please take notes for me. I have a patient right now.
Well, I tell you, I knew it. I knew it all along. You are sending front desk, back office, data analyst, data entry specialist. Yes, you are. I have seen clinics doing it. You are sending whoever is available to attend pair quality meetings. Stop sending random folks to pair quality meetings if you want to earn incentives. Stop doing that. Look at them. They are so worried. Have mercy on them. They don't know what to do in quality meetings. Yeah, they don't know. Here's the point. Don't expect $1 million in incentives from each of these pairs if you are not sending quality specialists to the pair quality meetings. It's like you are asking recognition on improved performance, on improved quality performance without any efforts on your end. It is like someone who wants to become a doctor but doesn't want to study. Let me be brutally honest. If your practice is expecting $1 million in incentive without investing a single penny on hiring quality experts, then quality might not be for you. Keep prioritizing volume over value. Be my guest. Your practice, your choices. But hey, all practices are not same. If you are a practice sending right people to quality meetings, then keep watching and see your incentives grow exponentially, because pair quality meetings will increase your incentive potential by providing you with the following benefits. Number 1, you will decode the incentive game for your practice by gaining an in-depth understanding of quality measures. Number 2, you will understand the supplemental process and will be able to submit data on the insurance, giving evidence of completed screenings and care gaps. And supplemental data is a foolproof way to increase quality score and earn incentives. Number 3, a peer quality meeting specifically scheduled for your practice with your provider relations associate or your quality manager, insurance quality manager, will provide insights on your quality performance. Number 4, when you meet your provider relations associate or your quality managers specific to a particular insurance, they might give you up-to-date care gaps data and sometimes even a priority list for your practice that you should focus on for improved quality score and max incentives. Number 5, why attend peer quality meetings? This is your chance to discuss your quality related concerns, right? So we will dive into each one of these. Let's unpack each one of these and their importance and relevance for closing care gaps and unlocking incentives. The number 1 on our list was understand your quality measures by taking the quality meetings, right? So attending peer quality meetings will help you understand your quality measures, and those little tricks that they give you in the quality meetings will help you to target measures and close care gaps accordingly. Some of you are saying right now, well, understand all the quality measures? What do you even mean by that? Is she out of her mind? She doesn't even know what she's talking about. Notice here that I mentioned your quality measures. Obviously, you don't want to and cannot focus on all the 100 plus quality measures in each peer's quality program manual. So do what you can manage and focus on quality measures applicable to your practice as first priority. Know the difference between incentive measures and display measures. I have a little something for you here. So a practice's CEO once took a quality meeting with me, and I told her the difference between incentive measures and display measures, but she wanted to be over efficient in front of her provider relations associate, and she said, just because it's a display measure doesn't mean we will not do those care gaps. As a practice, it's our responsibility to see all patients with care gaps, whether there is an incentive or not. But later on, I saw that shifting and the mask fell off. I'm sorry. I'm sorry about that story. So the point is that, let's be honest, if you are a physician, it's evident you want to earn incentives for your practice. So why sugarcoat? Don't be fake, be genuine, because some people can see right through fakeness. So anyways, what I recommend to practices is to make care gap priority lists. On first priority list, you can have incentive measures, including time-sensitive ones. In the second priority list, add display measure care gaps. That's a good balance. Some provider portals are just awesome. They tell you the difference between incentive measures and display measures right away. For example, Health First portal, which I will show you right now. Let's get back what I meant by focus on your measures when I said focus on your measures. So, in a quality manual, you will have 100 plus measures, and all of the measures will not be applicable to your practice, right? There are measures which are incentive measures, which means that you can earn incentive or financial reward if you close care gaps for those measures. So this in front of you is a sample practice, and this is their provider portal. So here we see incentive measures, and then there is a tab called display measures. And when I will switch to display measures, you will not see this dollar sign because facility cannot earn incentive, or this particular facility cannot earn incentive from the display measures. So that is what I meant when I mentioned to focus on your measures, which means measures that are incentive eligible measures, right? Now, that doesn't mean you shouldn't focus on display measures, right? But maybe you should come up with a priority list where you are putting all the care gaps with incentive measures in the first priority list, and then all the care gaps with display measures in the second priority list. Okay? And this is what I meant. So when you know your measures, then you will also know which provider training sessions, quality meetings you have to attend. Because in the quality meetings, they tell you explicitly which measures they are going to discuss. For example, let's talk about health first. They had a quality training session yesterday, right? On 23rd of September. And if you go to their provider education events page, they tell you which measures they are going to discuss. So it was kidney health evaluation, controlling blood pressure, and a couple of measures, which were also in this practice's incentive measures. So now I know that, hey, I have to take those quality trainings because they are going to discuss the measures which fall under my incentive measures. And so if I have any questions on those measures, I can ask in those quality meetings, right? So this is why you will be able to understand your measures. This is what I meant when I said your measures, your incentive measures, right? So this is how you know whether you should take a quality meeting or not. Maybe there are other quality meetings which are discussing display measures and which you might not want to take, but there will be other quality meetings which you wouldn't want to miss because they are discussing your incentive measures, right? So let's go back. So for health first, they have a really good provider portal. But again, some provider portals are good and some are not so good. And they will not have quality dashboards like Health First has, right? For example, Fidelis and Valcare, they don't have any quality dashboard or quality application integrations within their provider portals. So it was important for me to highlight the incentive measures versus non-incentive measures, because when you know your incentive measures, you also know what you have to discuss in the quality meetings, right? And this brings me to my second point, where I feel like a lot of you are saying, we know our quality measures, and so we can go and read the manual, the quality incentive program manual, whenever it's convenient for us, because we are a busy practice, just like the excuse care clinic. And so why even bother when we can read the peer provided quality manual that guides us and has a section on how to close gaps? I will open the Health First quality manual in front of you right now, right? But before that, let me tell you that quality manuals are vague. They often don't give the full picture. They often confuse you, are long, lengthy. Never mind, you are a busy practice. In fact, all practices are busy. So attend peer quality meetings for to-the-point insights on how to actually close a member with a certain measure as a care gap on your care gap list. Story time. This is a story time. So I'll tell you a little story on why attending quality meetings will save you hours of figuring out on how the quality measures work. So you are someone saying, I can read the measure definition later on in the peer provided quality manual, and I will know how to close the care gap. Let's bring it on. Let's open the Health First Quality Manual and go to the depression screening measure. Let's do this. So this is Health First Quality Incentive Program Manual. And for those of you who are saying, we don't have to take the quality meeting, we are so intelligent, we can directly go into the manual. And if we have any problem on a measure, we will see the measure definition here and we'll be good. Yeah, so let's bring it on. Let's see. And I want to pull up a measure for you called depression screening, right? And okay, so here they're saying you have to report due rates because the measure name is depression screening and follow-up. So now I'm like, okay, I have to do the screening and I will use a screening tool, PHQ2, PHQ9, and then there is a follow-up as well. So how do I report the follow-up in case it's a positive score or a positive screening? So then I go down and I'm like, okay, how to close this care opportunity? And here they're saying 1 depression screening per year meets the criteria. But if I go down again, they're saying things about follow-up visit. They're saying it is a 2-part measure. Yeah. So you see right there on top, they are saying 2 rates. Because the measure itself says depression screening and follow-up. So what do you do about the follow-up? Yeah, I did depression screening. I performed PHQ9 on a patient. What about follow-up? How do I report that? How do I earn incentive on this measure? Yeah, you are confused. The quality manuals can be confusing. So it turns out after taking the quality meeting, we were informed right away in straight language that PHQ9, PHQ2 screening is enough. And what about follow-up? The measure name itself is depression screening and follow-up. What about follow-up? Right? So a lot of you are saying, what about follow-up? The answer is yes, of course. It is recommended in case of positive screening. But the quality manager mentioned that it is not required for incentive, although it is a 2-part measure. But for incentive, as of 2025, screening is enough, according to this pair, which is Health First. There you go. Now, do you want to spend hours in figuring out this measure or simply take quality meeting? I leave that choice for you. I leave that choice for you and for your practice. Another reason why you should attend pair quality meetings is that at the end of most pair quality meetings is a supplemental submission demo, right? And practices, they underestimate the importance of supplemental data submission. And a practice once told me, why should we do supplemental? We don't do it here. Well, up to you, up to you. Supplementals increase your performance scores within weeks. And you earn incentives you thought was gone for good by doing supplemental data submission. Think about it. Why the insurance added supplemental? Right? Why they even added it? Because they know you already earned money or incentives on certain measures but couldn't capture due to either inappropriate coding, clearinghouse issues, some other reason. So supplemental is a bonus to give evidence. And hey, if they are telling you in the quality meeting how to create an account for supplemental submission, how to create a file on certain measure, the information that you need to fill in those files, how to handle errors on files, then why not just go ahead, understand the process, improve quality, and earn incentive? What's the harm? What's the harm in doing that? It's the foolproof way to increase your incentive. I have seen it. So another important thing about pair quality meetings is that you get insights. on your quality performance status, right? Now, the thing about peer quality meetings is that there can be two types of peer quality meetings. The most usual is the one which hosts participating or in-network practices and educates them on quality measures, right? These are usually called, quality measures training sessions. However, there is another type of meeting that you can additionally request, right? So you can additionally request a quality meeting with your insurance provider relations associate or your quality manager, which is a person specifically assigned by the payer or insurance to your practice to help you with quality. And these meetings, which are scheduled specifically for your practice, they provide you a lot of benefits. They will tell you the opportunity areas or the measures which are low-hanging fruit. So I remember I was in a quality meeting with Health First Quality Manager. And he told me, hey, why your practice is not capturing incentive on medication review? Because for medication review, you don't have to have the patient in office. And the good thing about this measure is that even the PAs can do it. Anyone can do it. And so this is a low-hanging fruit. So you get to know about such measures and such opportunities specific to your practice when you schedule these individual quality meetings for your practice. And you will additionally know measures that you need to improve on, right? You will also know measures that you have outperformed on. And this is your chance, like if you're confused that, hey, we don't know which are the incentive measures that we need to work on or which are the measures that are not applicable to our practice, then this is your chance to ask and go ahead. So this is a quality dashboard that I received for a practice when I requested the quality meeting with Fidelis. So, Fidelis, obviously, they have their quality training sessions, but as I just mentioned, you can additionally request a quality meeting monthly to see what is your practice's quality performance status. So then this lady was so generous, she gave me a dashboard and I was able to know where this practice was standing in terms of their quality. So this tells you everything. By the way, Fidelis doesn't have this kind of dashboard in the provider portal. So you will only get this if you are requesting this individual meeting every month specific to your practice. Otherwise, you are not going to get it. Yeah. So you are missing out on this opportunity. You see, because here it is telling you your opportunity areas, your maximum potential, remaining potential, and what you've earned so far. So it means this practice wasn't doing so good because they never knew that Fidelis is providing this kind of dashboard for every practice, but they were only giving it when you are having individual meetings with your provider relations associate, right? So you have to request it. You have to request it sometimes. Otherwise, you will not know your quality performance. You will never know. So as I mentioned about these, individual meetings that you can schedule with the provider relations associate, these meetings are so beneficial. Yes. And, when I had the meetings with Fidelis quality person, this lady was so generous that every month She not only told me about the facility's current quality performance, but she also gave me care gap lists. Yes, she gave me every month up to date and sorted. All her work was done for me already. She gave me sorted care gap lists. So you have to show interest. And then it will gradually become easy for you. Another thing is that obviously in the peer quality meetings, whether individual or the one which hosts a lot of practices, you can address your quality concerns, right? And what kind of quality concerns? Obviously, concerns regarding measures. For example, to earn incentive on BP measure, a member must have BP less than 140/90, and both conditions must be true. So this is the measure definition for controlling high blood pressure measure in the Health First Quality Manual. And now you might have questions and confusions like, is a member incentivized based on the most recent BP value? What if the BP value was over 140/90 in the last visit? What if BP value was equal to 140/90, right? You might have question like, can I submit supplemental if a member has BP less than 140/90 in the second last visit, right? So you might want to ask all these questions. And there can be so many concerns that you can discuss in quality meetings, but remember to send a quality specialist to quality meetings to get the best possible outcomes. Additionally, in quality meetings, you can address concerns regarding your care gap lists, like, invalid member phone numbers, deceased members, inactive new members. Yes, happens very often that new members assigned by insurance, but when you check their eligibility status or on their respective portal, they show up as inactive members. Then the question is, hey, should we serve these inactive new members and have an in-office visit within 3 months? And if there is any incentive at all for serving these inactive new members. Otherwise, the insurance might tell you at the end of the year or toward the end of quality incentive program here that, hey, thank you very much for serving our inactive members and boosting our reputation. However, your practice will not get incentive because they were inactive new members. To avoid that situation and accurately prioritize your care lists, you must address all such concerns in the quality meetings. Such detailed auditing of care gaps, as discussed in session 1, and then addressing those concerns in quality meetings, it will give you an edge over other practices who are totally unaware of such deep-rooted issues in care gap data, and those who are mindlessly relying on care gap automation platforms without a human in the loop. That is a wrap. Let's quickly recap why and how attending peer quality meetings is a golden ticket to boosting quality score and earning that $1 million incentive from a single pair. Yes. Number 1, attend quality meetings, understand your incentive measures better. You become smart as you realize that you don't have to spend hours in figuring out measures, so you earn incentives faster, right? Number 2, attend peer quality meetings, understand supplemental process, and submit supplemental, improve quality within weeks, earn incentive. Number 3, when you are in meeting with your provider relations associate or your quality managers, you know your current quality status. And then you know the opportunity area care gap measures that can be quickly closed instead of focusing on preventive screenings and measures where you have to wait for patient to get screenings done, right? Number 4, get sorted priority care gap lists from your provider relations associate or quality manager in the quality meetings specific to your practice. And hey, give those updated lists to outreach or automation teams. Clean lists, less confusion, close better, earn incentive. Last but not least, in the quality meetings, you get a chance to address your concerns. You know the real game because you are able to catch bare mistakes, right? Like inactive members. And then you're able to make strategic moves and earn incentives. In the next session, we will discuss about the importance of training the patient engagement teams and why your practice should guide booking teams on pair specific care gap list and do things like provide customized patient script, etc. Some of you are saying if we had to guide them on care gaps, then why not send them direct to quality meetings? Well, patient engagement should be trained on better outreach strategies specific to care gap patients. The goal is not to overwhelm them by sending them direct to quality meetings. For example, some payers provide reward cards to patients if they complete certain care gap screenings. So we will see how an informed outreach team will have better patient engagement and improved booking rates, hence improved quality score and more incentives. More on that in the next session.